Hi, I'm Dr. Joanne McDonald with Dalhousie University and the Reproductive Mental Health Service at the IWK Health Centre in Halifax, Nova Scotia, Canada. This is another in a series of educational videos that we've made to explore different topics in maternal mental health or mother's mental health, and to showcase a particular resource we've developed called the Mother's Mental Health Toolkit. Today, in this video, I'm going to talk a little bit about what some new directions are, new interests are in maternal mental health work. Hopefully you'll find this interesting and thought-provoking for your work with mothers. We always come back to this notion that we feel strongly about, which is that a well mother is really connected to the healthy baby and child, and that ultimately that child is able to contribute to a strong community. So we make that link very directly between the mother and her critical role with young children, particularly 0 to 5-year-old children, their development, and then our broader development as a community. And so part of this is that how do we get interested then in some early intervention models and collaborative models with other community service providers that take us from outside of the mental health specialty clinic and have us working really on the wellness side of the continuum of that concern for the healthy mother, the well baby, and the strong community. How does a community promote this? Well, not all communities are the same, and we may need to see that happen in different ways in different populations, in different geographical settings across our country or in your community. And I think that it really is important to acknowledge that each community can really play an expert role in knowing what are the key factors for their population, what are they seeing in terms of problems, but also what are the strengths that they know both are there both at the individual level and at the community level in their community. Who can they call on? What kind of work, what kind of interactions in their community will help them really along that continuum of the well mother to the strong community. I think it's important to always emphasize too that from small things can bigger movements and bigger changes grow. So many women will say, well, what can I do in this hour, in this day? I'm just here with my baby. I try to play with them, but every day seems the same. I don't really know if I'm accomplishing much. We know, though, that in all those small individual experiences with one mother and one child builds really on top of itself in promoting the child's security, in promoting their emotional and mental development, and their physical development and capacity for play and learning and interaction. Similarly, at the community level, we know that a small initiative, a conversation that you may have as a service provider with one woman on one day may have an impact and maybe be the beginning of a kind of interaction for her and a journey for her as a parent, what she can learn and how she can see herself and how instrumental she'll be in the life of her children starts from that one small conversation or that one point of information. We also like to draw attention to the connection between that individual baby and that individual adult caregiver in terms of attachment and attunement. Attachment is about, really in its formal sense, a sense of security that our needs will be met and that others will respond, particularly that important, central caregiver or caregivers will respond to us when we're in distress or we're in danger. Attunement is slightly different, and really we've become interested in this in the work with mothers because we want to know about how do women come to know their particular infant, their child. How do they stay tuned in to what their temperament is and what they might need from the parent. How do they read their child? How do they support their child? Women who've parented many children will tell you that they were all very different. And that, when they were able to succeed with a child, it was often because they could recognize the ways in which they were unique and that they needed to adapt their approach as a mother to that particular child. So this is about parental attunement. It's not unique for mothers. It's something that is important in work with young children, and you could say in work with human beings in general. But it's particularly powerful in the mother-child relationship. How do you build attachment? Well, we always emphasize that it's not some woohoo moment or some particularly exciting awareness that is that moment of bonding. That attachment, as it really plays out as a resilient factor for children into their adulthood, really begins with that kind of ordinary touch and care that happens, day to day and week to week. So it's why that parents need encouragement to understand that their basic responses to their infant, to holding them, even though they don't automatically start crying, that feeding them, clothing them, keeping them warm, hearing mom and dad's voice, being able to, kind of just have the presence of other people in our lives is a very important source of security. And that when that's absent, that can echo through someone's life well into adulthood, and is one of a number of factors that creates vulnerability to mental health problems. Particularly important, though, is mom's response to try to assist the baby at times of distress, particularly when the baby's hurt, when the baby is frightened, or when the baby is not able to sort of calm and soothe themselves. Sometimes babies cry for hours, though, and sometimes we don't always know why they cry. Distress is a part of the human experience, and babies can experience it a lot, and they can experience it seemingly very intensely. But we tend to think that the basic building blocks of attachment occur really in the presence of someone who attempts to soothe, who is not as distressed as you are as the infant or young child, who helps to put whatever the problem or the injury is sort of in kind of perspective, that it's something you'll recover from. Even when the distress can be significant, it's an important sign of security and of that community around you, that you have sort of someone present with you that helps you sort of calm yourself, and then ultimately helps to try and find solutions to the problem. So parents often think that there's something going to happen negatively in attachment if they're not able to perfectly soothe their child or immediately stop them from crying. But we know that it's more about that there is a response, and there is engagement and an attempt to soothe and interact in a calm way and a consistent way that builds attachment. Also, very important things happen at times of sort of kind of not planned, spontaneous play, fun, and connection. When you ask many people what they remember in a positive way from their early life, it will seemingly be a very simple experience. It wasn't necessarily the big family holiday or something that people spend a lot of money on. Sometimes it'll be an experience where they felt like they really belonged, they felt like they were really paid attention to in a particular experience, and that there was that kind of connection at a very direct level with their parent. So again, sometimes mothers will say, well, I just try to play with them all day, but we play the same things, and he loves to stack blocks, and I keep thinking maybe I should be doing something different with him. But his mother's attention to him, her interest in what he does with the blocks, can be those really important points of ordinary positive sort of connection and reinforcement. You're here, I'm watching what you're doing, I'm interested in what you're doing, conveys that you're important to me. You have a place sort of in my life, and you have a place in this physical home and in this family. One of the things that people in the medical field are interested in is a sort of whole area of research called epigenetics. And what's this really about? Well, you hear people talk about nature versus nurture. So nurture is how we're raised, what happens to us in terms of caregiving. Nature is thought to be sort of the raw materials that we come into life with. Well, so what's the genetics in our family? What was our experience in pregnancy, in delivery? Do we have any particular problems that would create sort of physical or brain kinds of challenges that we might then sort of see come out in our thinking, our emotional control, our ability to sort of relate? often the debate started as nature or nurture versus the other. Then people talked about, well, how does nurture and nature come together to create a particular person, and is it the same over our whole lives, or do we see that because we were a really reactive child in terms of our temperament, we tended to feel things really strongly as a young child and have strong reactions. So our parent may tell stories about how hard it was to sort of settle us, or how hard it was when we were super excitable to sort of calm us. But that same quality of intensity of emotion may really help a person in adult life to sort of follow a passion, to see things through, to draw other people to them, that intensity becomes a really positive force once they are older and know how to sort of modulate it and use it sort of in a good way in their own lives, in a good way in the life of the community. Epigenetics really looks at the kinds of things that we think has an influence on how nurture, or the things that happen to our raw material after we're born, can either increase or decrease certain factors in terms of our biological potential, both the potential for difficulty and the potential for good. So we tend to say that that early time, certainly in pregnancy, but even in the early months and years of a child's life, is a time in which the influence in their life, including their parental experience, can have a lot to do with how the genetic potential plays out. So let's say that you have an intense emotional nature, and that's very evident as a young child. So if you're happy, you're really, really happy. If you're frightened, you're really, really frightened. If you're sad, you're really, really sad. If you live in an environment that is able to let you experience that, be able to be calm in the face of that with you, redirect you, help you understand how you can respond both within yourself and in terms of your behavior that doesn't get you into difficulty, that can be a very sort of modulating kind of epigenetic factor. If you grow up in a family that ignores you totally, and with people that are extremely unreactive or not attuned, you can then be left to your own devices to sort of modulate or not these kinds of very intense emotions. Similarly, you can imagine that if you live in an environment where people also have very strong reactive temperaments and have not learned themselves how to temper that in their interpersonal style, including in their parenting style, that can sort of magnify something that we think of as an emotional dysregulation factor. So again, it's not saying that a factor automatically operates to increase or decrease a nature factor, but that it will somehow modify it or shape it. And we're interested as professionals working with families, particularly in the mental health field, of what are the things we can do in terms of these epigenetic influences that will help those nurturing factors modify any sort of risks that come from our nature. How do we come from a strengths-based approach to really promote the best of ourselves and minimize our vulnerabilities? Security and affection, it's important to know, come in many different forms. Here's just depicted, two caregivers, very different in appearance and gender, perhaps in setting, perhaps in temperament themselves or their opportunities, but that it's important to not sort of have predetermined ideas about how that's expressed or in what kind of family construction or family structure that you receive that security and affection. So one of the challenges in working with families, particularly as families change, in both how they function and everything from meal preparation to who supervises young children, to the neighborhoods we live in, how we travel, how we get information, and also sort of the combination of ethnicities and geographical backgrounds of people in our communities, that we don't make those assumptions about what constitutes security and affection. That there are many routes to the same positive end, and it's not sort of some particular version of comforting or connection and attunement that creates a safe and secure attachment. We're looking all the time in mental health work, including in mental health work with mothers, to look at how can we really put programs and interventions around this idea of a strengths-based approach. Because it's easy to identify problems, and we always say sometimes people come in with a lot of challenges sort of on paper. So you get a paper referral and you think, oh my goodness, how is this person going to be able to be helped? And then the real person comes through the room and you realize, actually, you know, they're not captured by those details on a piece of paper. There's something over and above that, and how do we work with them? Positive psychology movement really looks at that from a cognitive, behavioral, treatment point of view. And a lot of mindfulness-based stress reduction work also begins to sort of look at how do we stay present in the moment, how are we aware and accepting of what our experiences are emotionally, what our thoughts are, and then how do we work from that neutral base to really make good decisions for ourselves, understand ourselves, and be able to experience our emotions and our life in a positive way. So there are different kinds of models of resilience. This is just one that looks at what are internal factors and what are external factors. For instance, an internal factor of strength might be a really strong creative mind. So that maybe someone who didn't necessarily look like they had strong marks in school, or they may not have external achievement in terms of degrees or employment, but they really have a mind that they can use for them and their situation in a really kind of creative way. May also be part of their strength sort of as a parent. An external factor would be that although they may live in a very low-income neighborhood, it may be a very connected community where a lot goes on. There are some very strong leaders in that community, and so there are opportunities in that external environment that are helpful, that sort of mitigate some of the harmful threats that may come from some of the other challenges in that particular neighborhood. So it's a kind of a grid, as you can see, that we really think of as a way to think about models of resilience and think about how we interact in helping roles in community-based work. This visual I always like, because the person is climbing, and I looked at it and thought, now what exactly are they going to get to, what are they exactly are they going to do when they get to the top? Is there something they can look at? How high is it actually? What was the point of sort of them doing this? And it brought home to me the importance when we work with mothers of recognizing that both with our children and in our own experiences, that trying is an end in itself. So often one of the features of depression or anxiety is a kind of holding back, a giving up, a pessimism about oneself, and that it's really important when you work from the community base, and I think this is played out every day in many of our organizations and CAPC CPNP projects, is that there's a basic trying. Well, we're going to try this. Well, why don't you come in and we'll talk about this? Well, why don't you come to parenting group and we'll discuss that, because a lot of other people have challenges to manage the behavior of toddlers sort of as well. So part of it is a recognition that experience, trying things out, having the opportunity to be part of something and to be active is a bit of a factor that protects us against some of the difficulties of anxiety and depression. Structures and functions. Here's a building going up, a combination, it looks like, of wood and brick, and there's at least a few people working on this project. It really brings home that most of us, need to have some sense of structure and of our function within that. If you grew up in a particularly disorganized family or in a situation that kept changing all the time, perhaps through no one's fault, sometimes we're lacking that sense of structure and function. And it's really hard to know how to build that in our own lives, in our families. And this is some of the really important family development work that's done all across the country in terms of helping families with organization, helping them with skill development, helping them with routines, and the modeling and provision of that sort of within those family resource centers and within those kinds of community support providers. Sometimes just the same person to go to a group with. It might be a mom's coffee chat, and playtime for children every Wednesday is a structure in the life of a person who's never had anything happen the same way or the same time every week. from that is an important building block, and I think it's important to acknowledge that aspect of work that may not always seem glamorous or may not always seem particularly highly technical, but still has a really important role in the maintenance of mental wellness in mothers. If you look at, what's the one factor that we can be sure makes a difference in terms of outcome in mental illness, be it depression, adjustment problems, or biological illness like schizophrenia, we know that the level of social support that those individuals have in their lives is a key factor, perhaps the most important factor in terms of outcome. So you can have excellent treatments, you can have the best trained staff, but if that person lives in a circumstance where they have no social support, they're going to be challenged to do well. So, this is where most community service providers live, right? Their roles are very often support roles. Many informal roles in our community are support roles. So if you operate the corner store and you have young mothers and children, young families coming into your store on a regular basis, and you are interested in what's going on with their children, you're there to sort of discuss how things are going in the community generally, that can be a very kind of key social support. Many women will say when they live in isolated areas, I have to get out to go to get milk every day because, Bob that works down there is like the one person that I know is always going to be there. Similarly, that can be part of the role of formal supports in our communities, and encourage people as a place to begin to develop more intimate and perhaps more meaningful and consistent sources of social support in their personal lives. Interpersonal psychotherapy is an evidence-based therapy in postpartum depression that's been found to be very helpful, and in mild to moderate cases actually can be an alternative sometimes to medication treatments, even for women with a lot of functional implications to their depression. It really looks at how our experience of relationships in the past is really linked to our present sense of self, our present understanding and thoughts, and particularly our behaviors, and then how we may want to sort of address key challenges in our interpersonal lives in terms of improving our mental wellness sort of going forward. Remembering that our first relationships are in our family. And so there's a natural kind of continuum from our life and the way we were parented to the adjustments as we become parents and mothers, and then what the experience of our children has been. And I can't tell you how many times in our clinic we hear, I really want to do better for my children than what my experience was. Very few people come into our clinic. I can't really think of anybody that's come into our clinic and says, I'm really on a path to try and do this poorly. I've thought about this, and I'd like my family life to be challenging. Everyone really wants to be successful, and part of that is helping them understand where they are on that continuum. Not always out of difficulty do people always experience themselves negatively, nor do they always acquire negative habits or vulnerability and difficulty. But it's helping them understand that we're all on that path at the same time that the world around a given family is changing, and the needs of that family may be very different, including of their function as a parent. Emotional regulation is sort of a general term, and it's kind of deliberately general because it's not talking about any particular illness, it's not talking about particular neurochemicals in our brain, but it's really identifying really the behavioral outcome of people who struggle with understanding their feelings, sometimes even identifying them. Like this gal has got on her hand, how am I feeling? It's almost like she's asking you on the other side of the window, do you know how I feel? Because I don't know how I feel. And then furthermore, how do they know how to interpret how they're feeling and use it for themselves in a productive way, kind of in relationships and in their own inner life. Dialectical behavior therapy, which is sometimes shortened as DBT, is a particular kind of therapy that looks at emotional coping and tries to develop skills in terms of emotional regulation. And it really identifies that this is a core skill for all of us. Toddlers and young children really demonstrate, pretty commonly periods of emotional dysregulation. And this is normal when you're 2 or 3 to have a tantrum, to have a small problem or frustration and find that the child is crying and can't stop crying and then wants to throw the toy that they couldn't sort of figure out how to use. We know that this same behavior into adulthood really is considered, problematic, and we're really interested in how parents' experience of emotional regulation, their understanding, and their own capacity to do that and improve that in their lives, how that can help them be a role model for their children and help them to be effective parents in the realm of emotional regulation. All of illness isn't about emotional regulation, but certainly some adaptations, some aspects of function are really connected to our ability to understand and regulate our feeling states. Self-care, can be sort of said, well, of course I know I should eat right and I should exercise, yeah. But in particular in mood disturbances, which are one of the most common mental health problems for mothers, really these are really interventions in themselves. So many moms forget to eat regularly, or they eat something quickly, they're not really fueling their body properly, there's really no recreation or time of respite in their life, and there's no sort of regular exercise. And we're, in this photo you can see there's a mom with a toddler on their back, which, happens to a lot of moms. Not always are they in the park doing exercises. Sometimes they're trying to vacuum the floor and find a little person sort of attached to them. But one of the challenges is to find opportunities for exercise and fitness in our everyday lives. But it's just bringing home the point that these are perhaps not sophisticated interventions, but they're critical interventions. And I've made a mistake as a physician that I've been prescribing medications and maybe making sure the person is in therapy, only to find out when I ask them how their day is gone that actually they don't eat until about 6 o'clock at night. And that this is one of the factors in fatigue and in lack of connection and enthusiasm in their lives. So sometimes the intervention is to step away from the therapy and begin to look at this sort of basic self-management and self-care. So, we talk about how, part of the challenge in mental health work, as many of you know, is that there's not enough mental health workers or mental health hours or appointments to address the need that we see in all of our communities. And one could throw up their hands, but we also think it's important to recognize then that it's very critical that we begin to look at ways in which we can take the building blocks of mental wellness and even the things that are the initial response and prevention for mental health illness and symptoms, that we take it to the street, the mall, the field, that we begin to look creatively, as we've tried to do with our Toolkit resource, at what can we do as individuals or as a community that will help to build that. It's going to be very important, as we've already said, that the community as a whole, challenges the stigma of having a mental health problem, that we begin to look at the ways in which our communities are organized and the experiences we have as to the impact on mental wellness, as well as particular responses to mental health challenges or illness. And this will be best designed and directed from a given community, hence the whole notion of community-based. Not always are experts going to be able to really know what a given community needs, or even if they apply their expertise, it may go nowhere if the community is not mobilized and engaged in the mental health of all of its constituents. Collaboration is an important, idea, but it's also a term that gets thrown around a lot, and what does it really mean? So I looked at some visual images and thought, this is an old photo of some military folks from Nova Scotia here, from a museum photo. And is collaboration when we all line up, and we all line up in battle, and we all line up against the same thing, or are we all lining up for the same thing? Is collaboration, everybody doing their own thing, although we're all doing it in the same place, which is sort of the image from this snowstorm, and all the cars trying to get somewhere, but you can see that as they do, there's havoc created. And I suppose you could say there's an external factor in the storm that sort of has made collaboration difficult. Is collaboration when we all come from different points to a central point or a central goal? Or is collaboration really that we all pull together or pull in the same way? This, I think, is some kind of traditional kind of construction and barn raising that really demonstrates how what looks impossible for one person is quite possible with even, you can see there's no cranes, there's nothing particularly sophisticated in terms of equipment here that brings this wall up and creates stability. And you could say it's a good model for sort of how a community responds and builds stability around mental wellness. Particularly in the field of maternal mental health and in working with mothers and young families as community frontline service providers, we're really interested in that idea of how do we build new families. What are our families looking like? Is literally the face of the Canadian family or the family in your area, is it changing? And do we need to change with it in terms of what we need to do in terms of supports, in terms of interventions, in terms of education, and resources? And how do we turn our ideas into action within our own community? So you'll see I have ideas up there. I didn't have solution on the form on the screen, and that's really to challenge all of us to think about, again, what's going to fit, what's doable in our community. But like that one drop of water in the pond, it may be still important to try something and watch what happens and see if we're able to sort of expand on that. Thanks again for your time and attention. I hope this has gotten you thinking a little bit about some of the new directions in maternal and family mental health that go beyond specific treatments or specific clinics, and ways in which your community already has an important role, and you within that, in terms of creating and promoting emotional wellness, and limiting the implications and consequences for mental health problems, if not, mental illness. Thanks for your time and attention.